The Honourable Member for Etobicoke North.
Thank you, Madam Speaker. I rise today to speak on the throne speech, but first I would like to recognize the wonderful families of Etobicoke North and our caring, resilient, and strong community. Our families matter. They are good people and they work hard. What makes Etobicoke North such a special place to live, work, and play is that we welcome the world. We are proudly one of the most diverse communities in the country. We learn from one another, and we learn each other's beautiful cultures, languages, and religions. And we look after one another, and we lift each other up. Madam Speaker, I thank the tireless frontline healthcare workers of the William Osler Health System for their life-saving services, the Rexdale Community Health Center and Rexdale Community Hub and their partners for their important community care, including providing health services, legal services, delivering food, and providing computers and internet access. I thank all workers who provided essential services like those working in grocery stores, to personal support workers, to truck drivers, to taxi drivers, everyone who worked to keep our community and country growing. I also thank our tremendous community organizations for their work during COVID-19. Organizations like Albion Neighborhood Services that found new ways to deliver programs to youth and deliver hundreds of meals weekly. The Sikh Spiritual Center Toronto provided langar as individual packed meals to our community. The International Muslims Organization and the Lions Club that joined forces and served hundreds of families and provided food and essential supplies each month. And Trust 15 that kept in constant contact with families and continued inspiring and mentoring our amazing youth. I wish I had time to say thank you to all our organizations and all our volunteers. Know that I see your life-changing work and that I am grateful for the work you do each and every day. As I said, Madam Speaker, we are a community that cares and we are there for one another. Madam Speaker, before I ever came to Parliament, my own research area was on pandemic influenza, actually on the 1918 influenza, and preparing for pandemics. I help businesses, non-governmental organizations, and industry prepare for a pandemic. I ran pandemic exercises, and my priority will always be protecting the health and safety of the people of Etobicoke North and all Canadians, and in particular, our most vulnerable. Madam Speaker, the plan outlined in the throne speech is good for our Etobicoke North families and our community. We will take bold action on health, the economy, building back better, and building a more inclusive Canada. Madam Speaker, the throne speech outlines our plan for continuing to protect the health and safety of Canadians. In Etobicoke North in July and August, parents and teachers told me their concerns about their children heading back to school. As an educator, I understand. Our government listened and invested $2 billion to help provinces protect the health and safety of our children, teachers, and indeed our families as they return to school. Our government also invested and shipped personal protective equipment across the country. We sent the Canadian Forces into long-term care homes to help look after our loved ones. And we will make sure Canadians will be able to get a vaccine once it's developed, tested, and is ready. Our priority is to look out for all Canadians, and especially our most vulnerable. Poverty, hunger, good health and well-being, gender equality, and economic status play a role in who gets sick, who gets treated, and who survives. We must keep taking COVID-19 seriously to stop this second wave. We must all make sure we do our part to slow the spread of the virus by limiting our contact bubble, physical distancing, hand washing, and wearing a non-medical mask or face covering as needed. Ensuring Canadians are supported through this health crisis is the best thing we can do for the economy. Madam Speaker, the second part of our plan for the future is to do whatever it takes to support Canadians and businesses through the pandemic. That's why our government invested more than $19 billion to help provinces and territories restart their economies and ensure increased testing and contact tracing, increased personal protective equipment, and support for our most vulnerable in long-term care. To rebuild from job losses and strengthen our economy, we will launch a campaign to create more than 1 million jobs. We will extend the Canada Emergency Wage Subsidy to next summer, rebuild an EI system that works for all Canadians, and introduce further support for industries that have been hit the hardest, including hospitality and travel and tourism. Etobicoke North families should not have to choose between their health and their job. Madam Speaker, the third part of our plan is to build back better, to create a stronger, more resilient Canada. The last 6 months have been hard for our families and have shown fundamental gaps in our society as well as societies around the world. We must do everything possible to address these gaps. That means we will keep strengthening the middle class and help people working hard to join it. We will continue to invest in our communities, public infrastructure, and importantly, affordable housing. Our government brought in Canada's first national housing strategy, and most recently, the Rapid Housing Initiative will build or purchase 3,000 affordable homes across Canada. We will also invest in healthcare and address gaps in our social systems. High-quality, affordable childcare is not a luxury, it is a necessity. That's why we will build a Canada-wide childcare system that meets the needs of all Canadians. And for our seniors, we have committed to increasing the old age security benefit at 75 years of age and boosting the CPP survivors benefit. And we will also set new national standards for long-term care so that seniors get the best support possible. We will also build long-term competitiveness through clean growth while fighting climate change. Through COVID-19, we are reminded of just how important our natural world is and that we are not apart from nature, but rather a part of it. We live in a finite world with no planet B. We owe it to our children and grandchildren to protect our environment. Madam Speaker, the fourth part of our plan is to stand up for who we are as Canadians and defend our values. We will continue to walk our shared path of reconciliation, and we will continue to welcome newcomers and support family reunification. We embrace our 2 official languages, and we celebrate our communities and countries' diversity. But we know that there is more work to do to achieve gender equality and to address systemic racism. We know that anti-Black racism is real. We know that systemic racism is real. Unconscious bias is real, and they do happen here in Canada. Our community will always stand against racism, and our government will always stand with you. We will always work to build a better, more equitable country for all. Madam Speaker, to our Etobicoke North families, know that you matter to me, that my office and I will always be there for you, and know that we have worked tirelessly for you throughout the pandemic. Madam Speaker, we must also learn what we always learn following a pandemic, namely that science and public health matter, not just when we are in a crisis. We must share lessons, update and test pandemic plans, and ensure we are doing everything possible to protect the most vulnerable. And finally, we are one small planet with one human family. Disease knows no borders, and through the pandemic and beyond, we are truly